GLP-1 drugs have been blockbuster drugs, no doubt. They help so many people achieve the weight loss that they needed. But the problem is they come at the expense of muscle mass loss. About 60 to 70% of patients who take these drugs lose some muscle mass. And remember, muscle is the biggest currency for longevity. When we have muscle, it helps us regulate our insulin levels, our blood sugar levels. It helps us burn calories as we're sitting here talking. And studies have shown that low muscle mass leads to premature death. So it's really important to find a drug that helps decrease the blood sugar but preserves that muscle mass, and this is probably one of those drugs that the researchers are looking at right now. It has a completely different mechanism of action, and it is an oral medication. A lot of the GLP-1s are injectable formulations, so it has a lot of pros to it. They have not found any significant adverse effects, a little bit of increased heart rate in the first 28 days, but that adjusted, and they found that it burns fat, it decreases blood sugar, and it preserves the skeletal muscle. It is still in clinical trials. And I do have to say, while we're waiting for these next generation drugs to come on the market, it's really important for patients who are currently on these GLP-1 drugs to optimize their protein consumption every day to build that muscle mass. It's important for them to do 2 to 3 times weekly weight training. And also, I'm advising all my patients to consider taking creatine. It has to be discussed with their physician, but creatine may also help some preserve muscle mass.
Some muscle over here.
There you go, because maintaining muscle mass also, particularly in women, staves off osteoporosis. But a lot of people have problems affording either Wegovy or Ozempic or these other GLP-1s, or they can't get them prescribed, so they're making their own from ingredients where they come from, da-ding, China. How safe is that?
It is very unsafe. But John, here's the problem. Wegovy, Ozempic, these GLPs, they're about $1,000 a month to get them, and insurance typically is not covering them unless a patient has diabetes or related comorbidities. So I can see why it's enticing to do this, but I highly advise against it. These are unregulated, they are not standardized, there's no sterility guarantees, and the doses between the vials can be different, so it can lead to life-threatening complications. I think what has to happen here is for the pharmaceutical companies to step up. You know, in France, you can get a 1-month supply of Ozempic for $83. And it can be well over $1,000 here. And I think that the pharmaceutical companies have to bridge this gap and help lower their prices to match Europe.
Okay, so doctor, we want to stay skinny and we want to live longer.
Yes.
And so now there's a new blood test that could tell us how long we're going to live. Intrinsic capacity, I don't know what that means. Can you tell us?
This is a new, very exciting DNA methylation test that looks at a patient's intrinsic capacity. So essentially, the test takes some blood or even saliva, actually, and it analyzes markers that are linked to a patient's overall mental health, physical health, their cardiovascular capacity, and their immune system function. It takes all these parameters and pumps out this report that predicts how well you're aging, and it also gives you some to-do list of what you can do to improve your aging. And so it's a very exciting test. I think that it can become a very useful biomarker during your annual visits with your physician, just like your cholesterol and blood sugar levels. This can be looked at, and it can allow physicians to give our patients better advice on how to live longer. What I think of this, you know, there's a lot of cosmetic treatments in the past few years that have just exploded, and people are doing that to improve their external health. Now we have the ammunition. Well, exactly. Now we have the ammunition with these products to work on the internal health as well.
I'm not sure which is harder, the external or the internal.
You got to make a match.
Great to see you, Doc. Appreciate it.